Hi, my name is Casey Maples, and I'm a nurse here at Passway General Hospital. I've noticed some questionable nursing practices, and this is a video on the usage of bid alarms. According to the World Health Organization, a fall is defined as an event which results in a person coming to rest inadvertently on the ground or floor or other lower level. A fall can happen to anyone. People that are at risk for falls are disoriented patients, dementia patients, post-surgical patients. Um, and since it can happen to anyone, it makes falls the second leading cause of accidental or unintentional injury deaths worldwide. It is also the most common incident reported in hospitals. During hospitalizations, statistics show that 700,000 to 1 million patients fall a year. Um, so, to prevent the falls, the use of bid alarms has been researched as a possible effective solution. Um, the units that would benefit from any recommendations would be the geriatric, neurology, med-surg, psychiatric, orthopedic, any rehabilitation, memory care units. Um, According to three studies, the first study was the effects of an intervention to increase bid alarm use to prevent falls in hospitalized patients. It had two groups, the intervention group and the control group, over 16 nursing units at a hospital. The intervention unit contributed to 315 falls over 59,000 days, which resulted in 77 injuries. The control unit contributed to 408 falls over 83,000 days, which resulted in 111 injuries, one being a death. But with the statistics and the amount of patient days used, there was no real difference in using the bid alarm and not using the bid alarm. The next study that I researched was regarding the effectiveness of bid exit alarms, and it looked at how effective detecting body exit movements were. Bed exiting body movements were, sorry. 4 patients had a sensor only, 7 patients had a sensor and an IR beam, and then 3 patients had either a bed sensor and a bed sensor plus IR beam on various nights. It alternated which one they used. Because the patients exited the bed differently, the dual sensor was the most accurate, and it reduced the incidence of false alarms. Which is also an issue with the alarm fatigue, the patients setting off alarms inadvertently, and the nurse going in there and checking when it's not a true alarm. It was recommended that cognitively impaired older residents would benefit from a bid sensor plus IR beam. The next study was the effectiveness of a wireless modular bid absence sensor device. This sensor pad was positioned from the time of recruitment to time of discharge, and it to record all alarms, false or true. 31 patients consented to participate, and 91 out of the 119 were true alarms, 38 were false alarms, but 79 out of the 91 were true alarms that were genuine bid exit alarms. Another systematic review of literature that was researched, it was conducted on 5 studies regarding the use of bed exit alarms in a psychogeriatric ward. But due to the lack of the random clinical trials, all 5 studies found the evidence as inconclusive. The use of bid alarms to prevent falls is a topic that does not have a lot of supporting research. Some studies show that bid alarms decrease falls, while others show that it is effective but does not make a difference in the amount of falls that occur. But the common conclusion that all the studies that were researched have come to that it is great to use if it's not the only relying factor. So it should be used in conjunction with a fall prevention program on your unit. But it is effective, just not alone. According to the Center for Medicare and Medicaid Services, bid and chair alarms are or any position change alarms that make an audible noise near the resident is being starting to be considered as restraint. It's evidence shows that it's potentially harmful emotionally and physically to the resident. They experience a loss of dignity. They have sleep disturbance, decreased mobility, confusion, agitation. So some nursing homes are phasing out the use of bid alarms, but here it is great to use, but not solely just bid alarms. Continue to do your rounds. Continue to use your fall risk alert bands on your wrist, the alert signs above the bid. Make sure it is passed in handoff. Great communication of who is at risk for falls, and not solely rely on technology to help keep the patient safe.